Hi, classmates. My name is Jhoana Tovar, and I am 28 years old and reside in the Imperial Valley. The Imperial Valley is actually a small community, and there only happens to be one community college, which is the Imperial Valley College, also known as IVC. I attended IVC from 2008 to 2012, where I graduated with an associate's in nursing. And I then transferred to San Diego State University, where I received my bachelor's degree in nursing in 2014. In my last year of nursing school, I began to actually work as a scribe in the emergency room with a company called Physicist Scribes, which is from Texas. I worked as an emergency room scribe from 2012 to 2013. Once I received my license and everything was situated, I fell in love with the emergency room department, and I worked as a regular emergency floor nurse from 2013 to 2016. After I had my baby, I became a charge nurse in the emergency room and have been an emergency room charge nurse since 2016. I'm pretty much a creature of habit, and I don't really know where else I would be able to work and love what I do. Meanwhile, I was obtaining my bachelor's degree in nursing. I became very acquainted with a couple of evidence-based approaches that were being set in practice. Working in the emergency room, we actually have a couple that we do struggle and are still trying to improve. One of them being the CAUTI preventions, which is, catheter-associated urinary tract infections, and the sepsis bundle, which requires aggressive fluid resuscitation and like monitoring of lactic acid. And one of the newest ones that we've been working on is alarm fatigue, which seems to be a issue that almost every department has. But I would say the emergency room probably would be one of the biggest ones that has gotten accustomed to all the alarms in the department. So yeah, that's some of the evidence-based practices that we've been focusing on. Some capstone project ideas that I have in mind are pretty much based on the event in the emergency room, as I mentioned. I am interested in ways to improve patient outcomes. So pretty much preventing like alarm fatigue, ventilator-associated pneumonias, readmission to the hospital for stroke patients, and I'm not really too sure, but those are just some couple of ideas. I still am working on an idea that I would want to focus my time on. Some of my evidence-based practice goals that I would like to implement once I'm an advanced practice nurse would be for patients to know about their diagnoses and be able to prevent admissions back to the hospital within 30 days. And I would also want to improve protocols in the hospital for STEMI patients, especially since we do live in a small community that is not considered a high level of acuity, so we do not have a lot of resources. And I just would want to make more projects to be able to improve patient outcomes, as mentioned. Just so you guys get to know me a little better, a little thing about myself is that I'm actually a mom of two beautiful kids. My daughter, which is 3 years old, and my son, which is a year old. Second fact that is a little interesting, I would say, is I am the oldest of 4 girls, and you will be seeing that picture on the right-hand side. and I like traveling, and I like journaling as well. Little extras.